Nina, I believe that is member Michael Polson who has his hand up. If we could confirm that and make him a panelist, please.
I don't see anybody with their hand up. Oh, wait.
It just went back down. And hand raised again.
Let's see.
Just as Michael.
Michael, I just sent you a request to unmute. Hi,
Can you hear me now?
is this Michael Paulson?
This is him.
Oh, okay, all right. Let me make you a panelist. There you go.
Oh, sorry.
Member Christensen is also in the audience with hand raised, please. If we could make her a panelist.
All right, so Member Paulson, I know I could hear you. Let's see if we can see you. And actually, Member Christensen as well, if you could turn on your camera, please, so we can just do a quick check.
Okay, 1 second.
We got you. You're good, Robin.
How's the sound?
Perfection.
Great.
Great. Can you see me?
Yes.
And if there's if I disappear, maybe send me an email. The connection's a little unstable here.
Okay, gotcha. Thank you.
Hi, Michael. Good to see you.
You too, Ali. I realized that I was on mute when I said that.
Yeah, thanks for your messages. Do we have a quorum here already?
We do not as yet, Chair. We have 6 members on and we need 8 for quorum.
Okay, thank you.
Hi, this is Margaret Goldbar again, note taker. If there are any other members of the CAC who are currently in the attendee list, please raise your hand. We are at over 100 people, so it's getting more difficult to find you on the list. Thank you.
I believe Christine is. Yeah, Christina De La Rosa is on the attendee list.
Thank you. Just elevated her. Good morning, Christine. Can we do a mic and camera check, please?
Hello.
I can hear and see you. Perfect.
All right, awesome.
Moderator, Member Bauer is in the attendee list under Amber Parrish. If you could please elevate her.
There we go. Good morning, Member Bauer, or Member Parrish, I should say, excuse me.
Yeah, sorry, I had a name change, but I realized I should have signed in under Amber Bauer, sorry.
No problem, and we can,
Okay.
so excellent.
With Member Parrish here, Chair, we do now have quorum.
Great. Then can we do the roll call, please?
Yes, so Chair Jamalian,
Aye, present. Sorry.
Amber Parrish,
Present?
Member Frazier,
Present.
Member Christensen,
Present.
Member De La Rosa,
Present.
Member Beck,
Present.
Member Paulson,
Present.
and Member Tupy.
Present.
That is 8, and that's a quorum.
Thank you. Good morning, everyone. As the chairman of the CAC, I'd like to welcome all public officials, community members, stakeholders, and industry members to today's meeting. As you know, our primary focus is on advising the Department of Cannabis Control on the regulatory challenges that our industry faces. While we have made some progress, I want to emphasize that there's much more we could achieve. This committee is a valuable forum for bringing together diverse perspectives, but our powers remain very limited. In order to achieve any impactful collaboration, it is essential that the DCC ensures transparency in how resources are allocated and their processes. According to the last report, currently it takes an average of 258 days for a cultivation or distribution permit to be issued, with little to no transparency as to the timelines and order in which these applications are processed. These lengthy processes, in particular, are devastating for small business operators who struggle with real estate holding times during these delays. Our message today is clear. We can do better. To achieve a more meaningful collaboration, our public needs to activate and mobilize on a local as well as state level. By working together and educating our elected officials, we can hopefully create a more efficient and fair system for all. A transparent collaboration will lead to sustainability and a healthy industry, which is the goal of both sides. My experience personally with the shrinkage of small to medium cultivators underscores the need for a more streamlined and supportive process. Thank you for your attention and participation. This being our second to last meeting, we really need the input of the public. So thanks for all you attendees, and use the general public comment section to point us to issues that we need to look at. With that, a quorum is established, and I would like to move on to point number 2, which is the introduction of our new member. Carmela Beck, welcome to the committee. If you don't mind introducing yourself and giving us a little bit about your background.
Great. Thank you so much. Good morning. Carmela Beck. I'm based out of Santa Maria, California. It's a pleasure to serve on this committee. I've spent much of my career working in the organic industry, first at an organic certification agency, followed by time spent working as an apprentice on an organic farm. Spent a decade working at Driscoll's, managing their organic certification program for dozens of independent organic berry farmers, nurseries, and coolers. I spent a 5-year term on the National Organic Standards Board, sitting in the farmer seat. More recently, I worked on a cannabis farm in Santa Barbara County in the compliance and production management role. And unfortunately, the business has since exited the market. My current role is as the cannabis program manager for the County of Santa Barbara. So that's leading the CEO Cannabis Division, which covers business licenses and procedures, implementing legislation and regulations, monitoring compliance and enforcement efforts. And so I'm eager to see how we can create some more synergy between the DCC and local government cannabis programs, and look forward to working with the members and the public. So thank you.
Amazing. Thanks for being here. Good to have your perspective on the advisory committee. With that, we conclude agenda item number 2. Moving on to agenda item number 3. Deputy Director of Policy and Research is going to give us a little recruitment spiel for the next CAC, for the next iteration of the CAC. With that, Jacqueline, the floor is yours.
Thank you so much, Chair Jamalian, for that introduction. Good morning, everyone. As Chair Jamelian mentioned, we are quickly reaching the end of many of our terms of service for this committee. Members of the CAC serve for 2 years from the time of their appointment. Previously, all members' terms began and ended at the same time, so we have many of our committee members whose terms will be ending in August of this year. Moving forward, in order to best accommodate everyone's business needs, members are going to be added in as needed on a rolling basis so that eventually we won't have everyone's terms expiring at the same time. For this round, however, I am excited to invite members to apply to re-up their membership if you wish to continue to serve, and also extend this invitation to all interested parties to apply as well if you wish to join the committee and share your insights to help advise the department on regulatory matters. Applications for the CAC can be found on the DCC website, and an email blast will be going out with information soon as well. Please feel free to reach out to us at cac@cannabis.ca.gov with any questions. Thank you so much.
Thank you, Jackie. And I would like to reiterate to my fellow committee members, the next iteration is going to be only as good as the people that we recruit. So if you know people that would really add a good perspective to this committee, please do have them apply. Please encourage them to apply. That's really our job as well as the committee members. With that, we conclude agenda item number 3, moving on to agenda item number 4, public comments on item not on the agenda. This is a good time for the public to really point us towards issues and regulatory challenges that we have not on our radar. So with that, I'd like to open up for public comment.
Thank you, Chair Jamalian. All right, we are now taking public comment on agenda item number 4, which is items not on the agenda. So please keep your comments limited to this agenda item. Now, if you'd like to make a comment, please raise your hand by clicking the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak on each agenda item. And with that, let me refresh my screen and just a moment. John Byram, I've sent you a request to unmute. John Byram. All right, let's try this again. John Byram, I've sent you a request to unmute. There you go.
My name's John Byram, and for 8 years, I've been trying to get someone to do decoy operations on illegal dispensaries, illegal delivery services. And I haven't known anybody in California that has even done that. I would love for the DCC to actually start doing some decoy operations on illegal delivery services. And that's it.
Thank you. Kelly McCormick, I have just sent you a request to unmute. There you go.
Actually would like to echo the comments of the previous caller that minor decoy operations are needed. I've been trying to find information on any that the DCC has done on either the illicit or the regulated market, and I have not been able to find evidence that those are taking place. And we know that they make a big difference. The ABC, alcoholic beverage control does it regularly. Tobacco retailers are subject to minor decoy operations. And it's a really important piece of holding the industry accountable. And also, it serves the industry who is playing by the rules. It serves them well too, to weed out the ones who are not, operating by the law. And I'd also like to, we all know what happened with AB 1207, unfortunately, but I'd like to see emphasis again on reducing the child appeal of products like candy edibles. because we continue to see a growing number of children in the emergency departments because of accidental exposure to edibles. And it's just going to keep getting worse. The average age of the patients is about 3 years old, because they don't know that the marijuana edibles are, they think it's just regular candy. So thank you for listening and considering this. I appreciate your time.
Thank you. All right, Megan Stewart, I've just sent you a request to unmute. There you go.
The increase of child poisonings in the state is very concerning, and the packaging of marijuana products, if you were to look at it, it is very similar to that of candy and chips and sodas. And so I think that there needs to be more stricter regulation on how marijuana products are packaged to prevent such child poisonings, which are only rising. So thank you so much.
Thank you. All right, we are taking public comment on agenda item number 4, which is items not on the agenda. If you'd like to make a comment on this, oh, Judy Strang, I just sent you a request to unmute. Go ahead.
Opportunity. On behalf of the parent community, I think that marijuana retailers would be well served if they would name their store something different than, for instance, the Cake House, really popular here in Southern California, Cookies, really popular here in Southern California where we are. It sort of flies in the face of the argument that marijuana retailers want to make that they aren't appealing to those under the age of 21, when the business so clearly states that they are. I realize that those are branded names, and there's a lot that goes with trademarking your products as well as your store. But if marijuana retailers are serious about their intent not to attract those under 21, that would go a long way to making them look more serious.
Thank you. Michael Betancourt, I've sent you a request to unmute. There you go.
I agree with the prior comments relative to the need for just auditing or tracking sales to minors. I think that as a licensed dispensary owner, I would fully support those types of sting operations. So please take that under advisement. But the reason I was wanting to speak this morning is in relation to the pending DCC rescheduling, and I'm wanting this committee to get ahead of the game and look at what it means for the industry and how we can stay compliant with the potential federal regulations and state regulations relative to distributing and selling pharmaceuticals. I don't want to be under the gun, 3 or 6 months from now, whenever that that law changes on the federal level, and then we're scrambling to stay ahead of the game. So that's a subject that I hope this committee takes up sooner than later. Thank you.
Thank you. Sheila Diedenbach, I've just sent you a request to unmute.
Wanted to have an opportunity to respond to maybe some of the questions or concerns that were just shared regarding packaging for edibles and their appeal to minors. And as the 16-year manufacturer of cannabis infused edibles in the California space, I want to say that the issue is not that we need more regulation on the packaging. What we need is more enforcement. There are plenty of products out there that have appealing cartoon-like or comic strip-like or gaming images on them that are appealing to younger kids. It's not that we need to regulate it more, we just need to enforce the regulations already put into place. And those manufacturers, I mean, I will call myself among them, who have always approached it from an adult perspective. We're already compliant. we're competing in the market up against products that are non-compliant in our licensed retailers location. But I think even the retailers are not aware, they're not necessarily well read on what regulations are for packaging, because that's just not their wheelhouse. Nor could I tell you what the specific regulations are for cultivators, or what retailers have to adhere to. So I think it has to happen from the enforcement perspective, that when they're doing their inspections, specifically looking for those products that are non-compliant. That's all.
Oh, thank you. Bonnie Goldstein, I've sent you a request to unmute. Go ahead, Bonnie.
Okay, thank you. So I am a physician. I've been a physician for 34 years. The last 16 years, I've been a cannabis specialist here in Southern California. I've treated over 20,000 patients. I have a very big practice. I'm fairly well known. I trained as a pediatrician, and one of the things I agree with is enforcement of the packaging requirements. Something that everybody seems to be missing, though, is why are cannabis patients leaving their medicine out, whether it's a candy bar, gummies, or whatever, where their children can access it. So in the world of pediatrics, we teach parents, do not leave any medication out. Put it in a lockbox, put it high up. Every single person that purchases cannabis in a dispensary should be told, if your child ends up taking this and you go to the emergency department, you're going to get Child Protective Services in your life. So we advise you to keep this away from children. And in addition to children, keep it away from pets. We're hearing about animals getting sick as well. So I think it behooves the industry to not continue this black eye of kids showing up in the emergency room by making this part of the discussion as a patient is checking out from a dispensary. And we all know that things are in child-proof packages, but I've been in a room where a child opened up cough medicine right in front of me that I couldn't open up. Thank you.
Thank you. Call in user number 9. I've sent you a request to unmute. Oh, there you go. Call in user number 9. You are unmuted. Okay, put you back on mute. Caller user number 9. I'm going to move on. We could not hear you, so we'll move on and raise your hand again. I unraised your hand. Raise it again and get back in line here. Craig, Alpenglow Farms. I've sent you a request to unmute. There you are, sir.
It sounds like we're talking a lot about protections this morning, and I'm going to go along those same lines. And we're having trouble in the world of social media, and specifically Instagram. We've been quite active on there with education and so forth. And now we have gained a lot of traction, and there's a lot of fake accounts that are using our names and our faces and literally selling mushrooms and cannabis and contacting other folks within the industry, trying to sell on our behalf, and so forth. And we have a lot of the regulators that actually follow us, including Nicole Elliott, and we keep bringing this forward as a problem. We need protections. We're state licensed businesses, and these are really serious crimes that are being committed in that social media space. So we definitely have a right to use that space. We use it for education and awareness, but we need to figure out a way to put a stop to these fake accounts that are going out acting as regulated farms and businesses and selling illicit drugs. or whatever you want to call them. You know, being cons essentially. So I don't know how to move forward with that, but I just need to keep bringing it to the top because this is really hurting people and hurting our businesses that we put so much time and education and effort to be regulated. Thank you so much for your time this morning.
Thank you. All right, Becky Rapp, I just sent you a request to unmute. There you go.
I appreciate the previous caller's comments regarding their concern for packaging and flavors that are attractive to children and youth. We went down this road with tobacco, and parents are grateful that we now have a flavored tobacco ban for the same reasons that we need a flavored marijuana ban, as it is attractive to children. Marijuana, taking this a step further, we also need to have stricter regulations on advertising. Marijuana advertising lies. We have billboards all over our cities that say things like, why wait for better health, good weed, keep it loud. There's a lot of different advertising that is directly attracting youth viewers and young adults. Why are we allowing these messages to be sent to our kids? We need stricter regulations on advertising to pull back. And I appreciate you taking the time to consider these recommendations and hope we can see some changes. Thank you.
Thank you. All right, call-in user number 9. Let's try this again. I just sent you a request to unmute. *3 on your phone. All right, you are unmuted. All right, call-in user number 9, you are unmuted on our end. Oh, shoot. All right, next. Just raise your hand again when you can. Nicole Wharton, I've sent you a request to unmute.
To bring to everyone's attention, which I'm sure people already know, it's a California statutory change regarding cannabis vaporizers and new labeling requirements that starts July 1st. I have not seen anything on the DCC website for guidance for producers or retail dispensaries. So I just wanted to bring this to everyone's attention and ask if anyone from the DCC knows if there will be guidance posted on the website or a bulletin emailed out to everyone.
Thank you. Peggy Walker, I've just sent you a request to unmute.
In regards to the discussion on child poisonings and ER admissions and enforcements on package requirements to keep kids away, I believe that there's also been talk about agendizing the idea of THC caps, or at least discussion. And I wonder if this is an item that will be on future agendas, or if not, if it is something that you will consider for future agenda discussion. I think it's something we need to discuss. I hope that's something you'll consider. Thank you very much.
Thank you. And Whitney, I've just sent you a request to unmute. There you go.
Is Whitney Detheridge. I'm in a network of cannabis educators, and we can't get bank accounts. We don't sell product. We don't prescribe or tell people specifically what dose to take. We just want to provide general cannabis education to make a better informed consumer. This would benefit the entire industry. This would benefit the state from a public health point of view, but we're unable to do business simply because we say the word cannabis out loud. That's enough for the banks to just stop the conversation. There needs to be an option for us outside the very expensive cannabis banking option for people who are merely providing educational services. Thank you very much for your time.
Thank you. We are continuing to take up. There we go. Jason Sarouche, I've just sent you a request to unmute.
Thank you for this opportunity to speak. My name is Jason Sarouche, and I'm a Policy Research Associate at the Public Health Institute. I'd like to echo the previous comments about the importance of consistent and transparent enforcement efforts. Instead of leaving it up to businesses to try and interpret regulations, the DCC should really create guidance documents and other educational materials to help make sure everyone is playing by the same rules. That way there isn't confusion and there aren't certain businesses that are able to walk along a different line because they have a bigger legal budget. So yeah, really just making sure that these regulations are being enforced properly and it's clear to all businesses how the DCC expects them to operate. Thank you so much.
Thank you. All right, we are continuing to take comment on agenda item number 4. At this time, I don't see any other commenters. Let's give it a second. All right. Oh, Dominic, I've just sent you a request to unmute.
In a Calo testing lab in Southern California. I just wanted to address a couple of things. One of the things I think that this committee and the DCC should work together to make it a requirement to provide access to consumers for all COAs. Right now, it's only required for the retailers to have them on hand and not required to be accessible by the public. Additionally, want to commend the DCC for all of the potency inflation recalls. It's been something that we've been arguing and calling for since 2018. There's been 9 potency recalls in the last 2 months, which is great to see them trying to make this a more fair market. And hope they continue to do their hard work in this area. Lastly, I think that there needs to be a prioritization of public consumption spaces or licensing for such spaces, such as lounges. Right now, there isn't really places for people to consume the cannabis that they are purchasing, and that just doesn't make sense. Seems like a good opportunity for the state to make more money in taxes and also help brands sell more product. That is all.
Thank you. All right, last call for public comment on agenda item number 4. Items not on the agenda. Last call. All right, Chair Jamalian, I see no further requests for comment. Would you like to close public comment?
Yes, thank you, moderator. That concludes agenda item number 4. Moving on to agenda item number 5, which is addressing hemp products, something that's been on the forefront of our agendas for a while. The Department of Public Health will now give a presentation and an update regarding the notice issued by CDPH to address the sale and distribution of hemp products. I'd like to welcome Benson Yee, Chief of the Food and Drug Branch at CDPH. Mr. Yee, floor is yours.
Mr. Yu, you are now a presenter and you can unmute yourself. There you go.
Good morning. Can you hear me?
We sure can. We can see you too. Thank you.
Great. Thank you. Good morning, everyone. My name is Benson Yee. I'm Chief of the Food and Drug Branch in the California Department of Public Health. Thank you for inviting me here today to speak to the Cannabis Advisory Committee and attendees about the department's recent public communications concerning industrial hemp products. On April 26th, Governor Newsom directed the Department of Public Health and the Department of Alcoholic Beverage Control to issue notices addressing the sale and distribution of illegal hemp products. Per the governor's announcement, these notices seek to ensure compliance with existing law to protect Californians, particularly youth, from mislabeled and potentially harmful hemp-infused products. Subsequently, on April 26th, the department issued a letter to industrial hemp licensees and stakeholders about the public health risks associated with illegal industrial hemp products and the liability to manufacturers and distributors and the expectations outlined in the law. Specifically, the California Sherman Food, Drug, and Cosmetic Law, or we call it the Sherman Law, provides that the department has the authority to regulate industrial hemp products. Specifically, industrial hemp products sold in California must meet the following requirements. California industrial hemp manufacturers and distributors must register with the department and obtain an industrial hemp enrollment and oversight authorization. Industrial hemp products must not contain any THC isolate or chemically synthesized cannabinoids. Labeling requirements must be met. This includes a scannable barcode or QR code with the following information: product name, manufacturer, packer, distributor, address and phone, batch number, cannabinoid concentration, expiration or best by date, health statement, a message that says keep out of reach of children, and an FDA statement basically stating that the product has not been evaluated for safety or efficacy. And then finally, industrial hemp products must be not marketed to children. In the letter, we also reminded that our licensees and industrial hemp stakeholders that fines, penalties, and product recalls are authorized in the Sherman Law. And then recently, on May 30th, the department warned consumers not to drink Mary Jones hemp-infused sodas. These products are mislabeled and contain a prohibited ingredient that may put Californians at risk of unintended intoxication, illness, or injury. Industrial hemp products are legal in California, but certain intoxicating ingredients are prohibited under state law. And the state confirmed through laboratory testing that these products were mislabeled and violated state law and contained the prohibited ingredient of THC isolate. I want to thank you again for this opportunity to talk about the department's recent efforts concerning industrial hemp products. Thank you.
Thank you, Mr. Yee. Do any of my fellow committee members have questions or discussion points? Mr. Yee, I have a question. You mentioned that the enforcement against packaging that appeals to children, and specifically including THCA or Delta 8 products, which is what I'm assuming you were referring to. Is that correct? You're muted.
Can you hear me now?
Yes.
Great. Thanks for your question. So we're looking for anything that's in non-compliant with the state law. And so that does include marketing to children or does include THC isolate. We'll have to investigate what that isolate is and things like that. But under the law, any THC isolate is prohibited.
Right. And I think a lot of us, and I think a lot of the callers that were calling in for the previous agenda item, often mistaken that industrial hemp products that are more readily available at liquor stores and gas stations and such versus regulated products that have a limit on the THC cap are only available in dispensaries where you have to check in with an ID and you get tracked in case the DCC does do a recall. Could you educate us a little bit more on your findings in regards to these products being sold at these gas stations and accessibility to kids? And I wonder if there's any data that differentiates between toxicity cases of children coming in, whether those are actually from industrial hemp versus from cannabis. Is there any data on that?
Yeah, no, thanks for your question. And it looks like it's a multifaceted question. So let me answer the first part. You know, as we know, these industrial hemp products are treated as, under our laws, treated as a food, cosmetic, or pet food. And so they are widely available in convenience stores, gas stations, as you speak. And so, you know, we receive complaints and we address them, we prioritize them accordingly, especially complaints concerning that with injuries and illnesses, we treat those as a high priority. Now, with that said, we have received complaints on children ingesting these type of products, and those are prioritized. And we don't have specific data to discern whether the intoxication was caused by industrial hemp or cannabis. Based on my understanding with poison control centers, the data is is mixed in together. And so it's very hard to tease that out.
Thank you so much. That's really insightful. I really appreciate it. Do we have any other questions or talking points that the committee members want to discuss? Otherwise, I would open up for public comment.
Would this be, through the chair, I had a couple comments around hemp. Would this be the right place to make that?
Absolutely.
Yeah. So I just want to thank the board for bringing this to our attention. I think for us, we are seeing a lot of the cannabis market is highly regulated, and many of what the consumers' complaints are around are the unregulated hemp industry. And we see highly intoxicated inhalables that are not regulated. And obviously this comes from the 2018 loophole through the Farm Bill. And I think it really, at least what we're hearing in the unionized cannabis industry, that it is undercutting the legal market, and it's consumers sometimes don't know the difference of what the harm that they are opening themselves up to by using untested and illegal product. And we see consumers can easily buy intoxicating product at a 7-Eleven or a corner store, or even on Amazon. So again, I think losing a cannabis shop isn't just about a job loss. It also affects our communities when we have workers who can't pay their rent, they can't buy groceries, they're struggling in their community. So again, I think this is such an incredibly important topic. What we're seeing is the kind of shadow market of hemp. And I just really commend the conversation. And I think grounding this conversation in data about what's actually happening is incredibly important. And I look forward to hearing the public comment and also the comments of my fellow members of this committee.
Thank you, Member Parrish. Member Paulson, floor is yours.
One is just a clarifying question about the isolates. Is it just THC isolates that are prohibited in products in the state, or is it also include other kind of cannabinoids?
Currently, the law is THC isolate.
Okay, great. And one other follow-up.
And let me add to that, THC isolate and any synthesized cannabinoids.
Okay. And so the way I understand it is that is regulated kind of at the point of sale where consumers might interact with that. So is the production of it too? Like, can a hemp producer produce these items?
So can you hear me now? Great. So the state law concerns the manufacturing of industrial hemp products and distribution of industrial hemp products in the state of California. And so we oversee the manufacturers and distributors, we meaning the Department of Public Health. And so the state law applies, and so it is illegal or prohibited to manufacture or distribute or sell industrial hemp products with the prohibited ingredients. That is the THC isolate and or synthesized cannabinoids.
And so my rudimentary understanding of how the isolate process works is that through the processing, different kind of cannabinoids become available or extracted. Is the idea then that manufacturers of hemp would then kind of like discard the THC isolates that emerge from their processing of hemp?
Well, I don't know what the manufacturers would do, but based on the state law, they can't market it or distribute it in California.
Michael, it's ultimately a wash. It's a conversion. What they do is they convert the compounds by using volatile washes, often hexane, extractions, gas-based extractions, and it's a process to turn a certain cannabinoid into another, which then when it's decarboxylated by lighting it will turn into yet another, right? So you take a hemp, you turn a CBG into a delta 8, and the delta 8, when it gets lit, basically has you know, a similar effect as delta 9 THC, but is not as potent. So that's why also a lot of these hemp-derived edibles are 400 milligrams, because that's about what mimics 100 milligrams of real THC. That's sort of the play there. I think one thing that I experienced in San Francisco, you can buy these products at almost every smoke shop. You can literally go in and get your Delta 8 vape pen. You can get your Delta 8 gummies. So, Mr. Yee, would it behoove the consumers, if they see that and know better, to call in a complaint with the CDPH? Or how does something like that come to your attention where it then enters the enforcement loop?
Yeah, in our public notification, we have a consumer complaint. And so I'd be glad to share that with the committee members, and they can report that through our process, and then we will intake the complaint and investigate accordingly.
Great, thank you. I think a lot of people, attendees on this call, will appreciate that information, and their activism will probably go a longer way identifying those than trying to get cannabis dispensaries to change their packaging. Host Lemke.
Sorry about that. That was a
Oh, okay. Any other? I was like, oh, Nina is getting into the discussion. Any other comments? Any other talking points? Otherwise, I would like to open for
Another
public.
question, Chair.
Antonia, floor is yours.
Yeah. Question. Is there a definition of THC isolate? Trying to better understand exactly what's being captured, whether it be, you know, other isomers of THC. And then the follow-up question, or I guess statement I have, is that during this conversion process, these products undoubtedly break the federal threshold of THC. A lot of them then, you know, dilute or do other things to bring them back under. And from what I'm hearing, it sounds like any process that would create a quote unquote hot substance over the federal limit is therefore illegal to manufacture as well. It's not about the end product, but also the end process is under scrutiny as well. As I'm not sure that second question. I'm trying to get out there, but the first one is there a definition for THC isolate? And two, is creating federally hot products at any time throughout the process illegal or not under the vision of the CDPH?
Yeah, thank you for your question. I'm going to have to check with our team on that. So if you send it my way, I'll be glad to look into that. But as far as the law, you know, the law doesn't, I don't recall if it was a specific definition, but it does say, you know, THC isolate are prohibited.
I just had a quick question for Mr. Lee. Mr. Yu, I'm sorry. So you're talking about THC isolate, and what is the around THCA, right? THCA flower, once it gets lit, becomes THC, but it's not THC and it's not THC isolate. So my question, because one of the things that I think a lot of people, myself included, are kind of getting caught up on is there's been a big popularity around using the term intoxicating hemp. But it's, you know, alcohol is a toxin, a neurotoxin. Hemp is not a neurotoxin. It's actually a neuroprotectant. And that was from the federal government. They have that in the Health and Human Services. That's the definition. So even though we're using it because it's a big buzzword to say intoxicating hemp, it's actually not an intoxicant, right? And so when we're looking at this and we're saying, I totally get like vape pens, Delta 8, Delta 9, the washing that, you know, that happens, that's a chemical, but THCA is a naturally occurring thing inside of a hemp plant that when you test it is lower than 3%. And when you light it, becomes above that thing. So I'm trying to understand, are y'all just talking about things that can be infused into a vape or an edible because it's literally two different cannabinoids, right? THCA before it becomes THC. Because I think that's also an important thing to clarify for people around that. So I'm just curious.
You know, thanks for your question. And again, I'll have to check with my team on that. But I just want to clarify one thing, you know, that I heard from you and earlier. I just want to clarify that industrial hemp used to make inhalables are prohibited to be sold in California. You know, they are allowed to be manufactured, but they have to be distributed outside of California. So that's the law we have. But regarding your other question on THCA, again, I'll have to check with our team on that.
Mm-hmm. Right, and that's why I just wanted to check. So I just want to make sure I'm clear. If I'm a hemp grower in the state of California and I have THCA flower, I cannot sell it inside of California, but I can ship it to Tennessee, which is where
Yeah,
I'm just trying to make sure that we have the legality, because for a lot of
so
people, you know, we want to make sure we're not recriminalizing a flower again, you know?
so we don't regulate the growing. We just regulate at the manufacturing and distribution end of the industrial hemp product.
But there's not a manufacturing in flower, right? Like as a hemp grower, I could just sell my flower.
That would be
locally.
CDT. That would be the CDFA though. So that would be the agricultural department rather than CDPH, is I think what Mr. Yee is trying to
Okay.
say.
Awesome. Thanks.
Thank you, Mr. Yee. With that, I would like to open up for public comment, moderator.
All right, very good. We are now going to be taking public comment on agenda item number 5, addressing hemp products. If you would like to make a comment, please raise your hand by clicking the hand icon next to your name if you've logged onto the meeting, by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning. Each member of the public will have one opportunity to speak on this agenda item. Sorry about, excuse me. And with that, we'll go to our first commenter, and that would be Bonnie Goldstein. I've just sent you a request to unmute. There you go.
Thank you. Thank you, Mr. Yee, for your comments. As a cannabis clinician that takes care of many children with severe autism and epilepsy, many of them cannot afford the very high cost of high CBD, low THC, full spectrum products from a dispensary with added 30 to 40% tax. These children often require very high doses, like 25 milligram per kilo per day, which in some cases can be over 1,000 milligrams. They often rely on naturally occurring full spectrum hemp derived CBD products, which apparently are now being conflated with the synthetic, excuse my term, garbage that's on the market that is dangerous. In my 16 years of doing this, I have not seen any issues with the naturally occurring hemp. Can you please make a comment on whether or not those products will be protected so that these families can continue medicine that these children have relied on and weaned off other medications to basically be life-saving for some of them? Thank you.
Thank you for your question and comment.
I'm gonna step in here. We are actually taking public comment. We are not taking questions at this time. We're taking public comment on addressing hemp products. So Cella Fiorini, I've just sent you a request to unmute. There you go.
Okay, hi, thanks. I'm Tella. I'm a family caregiver to loved ones living with dementia, managing a seizure disorder, and fighting cancer. As we understand it, California AB 2223 aims to close the loopholes around THC isolate or synthesized products, but it may also limit the natural 0.3% THC in natural hemp CBD to literally 1 milligram per entire product. Building on what Dr. Bonnie just said, these changes, they're backed by the California Cannabis Industry Association and the governor's office. The idea is to stop the sale of semi-synthetic THC products outside the regulated cannabis market. We're all cool with that. Everybody is. But it seems that this would also outlaw natural, full spectrum, affordable hemp CBD oil like my loved ones rely on for a decent quality of life. This would be a disaster for people managing seizure disorder, fighting cancer, living with dementia and autism. Please, please protect natural, full spectrum hemp CBD oil with 0.3% THC in it, naturally occurring. Targeted regulation, maintaining safe, naturally occurring 0.3% THC levels, and enhanced oversight, of course, can achieve regulatory goals without harming those of us who rely on full spectrum CBD oil for managing chronic conditions. This more measured approach ensures that patients continue to have access to effective and affordable treatments while addressing safety concerns associated with the unregulated THC products you're talking about. So thank you for your time and consideration. Please protect natural full spectrum hemp CBD oil. And after the public comment, I hope that Mr. Yee can address Dr. Bonnie's question, because it's basically the same questions I have. I'm really, really worried.
Thank you. Beta Pache, Beta Pache, I've just sent you a request to unmute. There you go.
Thank you for your time. My name is Beta and I work for a cannabis manufacturer here in Southern California. And I think a main issue we're having is how to test for how testing labs can test for conversion leaders, because in all actuality, the conversion leaders are entering the legal market because of the low production costs, and the leader prices have dropped astronomically. So it's really hard for the legal manufacturers of Delta 9 THC distillate to stay in business. So I think it's really imperative that the DCC comes up with some type of testing standard in order to determine what is a Delta 8 leader that's been created from hemp and blended with Delta 9 to pass those potency tests and enter on the legal market. Thank you for your time.
Thank you. Craig with Alpenglow Farms, I've sent you a request to unmute. There you go, Craig.
Me?
Yes.
Mike. Thank you. Yes, I agree with the two previous callers prior to the last one. I feel it's really important we get this right. There's a lot of people that depend on the good that's coming through this process. And we've learned so much with regulations that get passed too quickly that have some devil in the details, so to speak. So please, let's be clear and precise with what we're trying to achieve. Thank you.
Thank you. All right. Hamina Villasenor, I've sent you a request to unmute. Go ahead.
Policy analyst at the San Diego Regional Chamber of Commerce. And on behalf of the Chamber and over 2,200 small, medium, and large employers in our region, I would like to extend first our utmost gratitude to CDPH for their efforts to address the sale and distribution of illegal hemp products. This has been a critical step to further close loopholes in federal law that measures THC content by weight rather than intoxicating effect. However, more action is needed to decrease their accessibility, which undermine the legal cannabis retail market, like few other board members mentioned today.
Are you still with us? Hamina, I think you've dropped off. All right, Hamina, I'm gonna mute your mic, and if you have more to comment, you still have another minute left, so you can raise your hand again. Dave Conan, I've sent you a request to unmute.
Hello?
There you go.
Can you hear me now?
Yes.
Great, great. Thank you very much. Appreciate the public comment on this issue. It's had a personal issue for me. And it sure seems like once again, the adult use cannabis industry is getting together with state and federal lawmakers that are putting profits and obscene taxes over patients. Patients like me who need high quality, tested, federally legal, full spectrum CBD from hemp to legitimate US companies who are not exploiting the loopholes of the 2018 Farm Bill. You want to fix the bill and regulate D8, D10, and use other synthetic derivatives? Great. But don't do it at the expense of patients, including not just children, as Dr. Bonnie spoke of, but I'm 60. and their medicine. Patients who use, like me, who uses 1,000 milligrams of hemp-derived full-spectrum CBD every day to help control a new seizure disorder. And I get them from organic tested companies from out of state that would effectively be made illegal. Buying CBD at a licensed adult use cannabis shop, if you can find it in Los Angeles, would cost $100 a day plus 38% tax compared to $150 a month from these legitimate companies making excellent products, not exploiting these loopholes. Ban the synthetics, no problem. But this amendment, the Farm Bill, and all of these state laws that are being pushed by the cannabis industry are going to destroy these thriving full spectrum hemp companies, CBD companies that are making good medicine. They're helping people every day. So go ahead, regulate those synthetics, but do not put patients, destroy patients again, thanks to commercial cannabis. That's all I have to say. Thank you.
Thank you. Okay, Hamina, I'm sending you a request to unmute. All right, go ahead.
In order to decrease the accessibility to these types of products, which undermine the legal cannabis retail market, they put cannabis licensees at a disadvantage because they cannot use any inputs from hemp, and cannabis products are subject to more costly regulation and taxes. So we believe that by tightening regulations on intoxicating hemp, and also focusing the committee's advocacy efforts with federal leaders to address the vagueness in the 2018 Farm Bill, which has caused challenges for states and localities to respond to this public health and safety issue. In addition, we also encourage the committee to work closely with the DCC to create a pathway for well-regulated hemp and cannabis industries to participate in the federal and state legal hemp marketplace. So we appreciate your efforts to curb intoxicating and unregulated hemp, and look forward to working with all of you to address this pressing issue. Thank you.
Thank you. All right, Josh Swider, I've just sent you a request to unmute.
Company called Infinite Chemical Analysis Labs out in San Diego, California. We're an annual licensed DCC testing lab. I would like to bring up the point that the CDPH has required the synthetic conversion testing of cannabinoids, and someone brought it up on this phone call as well, of Delta-9 being synthetically converted from the CBD. We recently have offered the DCC a validation for the detection of synthetic conversion inside the DCC market, as well as the hemp market. And the CDPH. If the CDPH or the DC would ever like to talk about this, we have a validated method. We're the first in the country to have a validated method in the state of Michigan. We would use a very similar method for the state of California, if allowed, but right now we're being denied because it's not a part of the regulations. I just wanted to put that out there and let people know that that should be being screened and looked for, and it is in the cannabis system as well as the hemp system. Thank you.
Thank you. Pam A, I've sent you a request to unmute. Wait, Pam, hold on one second. I just had to send it again. There you go.
Okay. Pam Andreessen. I own a licensed cannabis distribution location in Southern California, as well as I have an industrial hemp brand that is being sold in states like Minnesota and other non-adult use states. I agree with the other callers, the medical practitioners as well as patients that need to have continued access to quality cannabinoid products. While I appreciate some of the challenges that the licensed cannabis industry, of which I'm also part of, my experience with mass retailers in the state of California lead me to believe that they won't have room to assort these low dose industrial hemp products. The stores are small as it is, and inventory turnover is extremely critical. So the retail locations will likely continue to assort and carry high milligram products, leaving the low THC industrial full spectrum product potentially minimize access for consumers. So I would encourage the support of the existing Farm Bill with a appropriate regulations, eliminating the synthetics. But I would like to see consumers still have access to quality full spectrum products in the state of California and beyond. Thank you.
Thank you. All right, Whitney, I've just sent you a request to unmute. Go ahead.
To echo that patient access is really key here. I've already been contacted by a number of friends and family who can no longer get the products that they used to get because companies outside of the state are already ceasing to ship to California. It is near impossible to find non-intoxicating products at legal dispensaries, especially if you are outside of the greater Bay Area or the greater Los Angeles area. And there are people who rely on CBD and CBG without the intoxication. And I would love to know that the state is going to ensure that there will be options for them outside of the current dispensary option. Thank you.
Thank you. All right, we are continuing to take public comment on agenda item number 5, which is addressing hemp products. At this time, I don't see anyone else. Oh, hold on a moment. I have a few more. Jason Charouche, I've just sent you a request to unmute.
Members of the committee, my name is Jason Sarouche, and I'm a policy research associate at the Public Health Institute. Thank you again for this opportunity to speak. The Cannabis Advisory Committee and the CDPH are clearly aware of the proliferation of hemp products that contain synthetically derived cannabinoids in California. So I'm glad the CDPH representative clarified that cannabinoids produced through chemical synthesis are not allowed in hemp products. While the CDPH website does discuss synthetic cannabinoids in the FAQs, it would be really helpful if the CDPH created and published a more comprehensive guidance document clarifying their interpretation of the current definition for hemp in the California Health and Safety Code, which explicitly states that industrial hemp does not include cannabinoids produced through chemical synthesis. Obviously, a lot of businesses are interpreting this differently, thinking they can take a cannabinoid from hemp and use chemical synthesis to turn it into a totally different cannabinoid, which, as you've stated, is not allowed. And building on committee member Fraser's question about THC isolate, there really does need to be a definition for it, or at least the CDPH's interpretation of that term. As committee member De La Rosa discussed, THC can refer to a number of molecules. The state definition for THC or THC or comparable cannabinoid does include many different types of THC. So by state definition, it does refer to a lot of different molecules. So it would be great to know what that specifically is referring to so businesses know how to operate. And isolate, is it 100% one molecule? If it's 99.5% of that molecule, is it not an isolate anymore? These are all questions that really should be answered. And so businesses, again, know how to operate and everyone is playing by the same rules. Thank you so much for this opportunity to speak.
Thank you. Lori Dubin, I've sent you a request to unmute. Lori, there you go.
Go ahead, Lori. Yes. Hi, Lori Dubin. I'm with a all-volunteer organization called Marin Residents for Public Health Cannabis Policies. We're in Marin County, where parents and educators, medical professionals, ER docs who see kids in psychosis every week in their hospitals. We've had to do so much work locally because state action has been lacking, state enforcement, a lack of public health voices in regulations. So I applaud cracking down on what another speaker referred to as synthetic garbage and inhalables. We have seen these products that are flavored inhalables and synthetics in the form of vapes, disposable vapes, and edibles in our grocery stores, in neighborhoods. We know our middle school and high school kids are accessing them, so there cannot be enough clarity by CDPH as to what's illegal. As Mr. Sarouche alluded to, we need clarity for local enforcement, and we need public health voices at this table, which have been lacking. This is garbage. These are predatory products, and our kids are suffering as a result with mental illness and anxiety and depression related to cannabis and now hemp. So thanks very much.
Thank you. Sequoia Hudson, I've just sent you a request to unmute. Go ahead, Sequoia.
You hear me?
Yes.
Perfect. Good morning. I just really wanted to say thank you for having this conversation. As convoluted and complex as the topic around cannabis versus hemp is, due to the past, century of oppression and suppression of the cannabis plant, we've come to a space where we've landed where cannabis and hemp has been bifurcated, and we're trying to come back together and find a place where it can again be one thing for multiple purposes. It's so complicated, and we're at a regulator and educated person conversation level right now, and it's just so confusing and complicated for the average person to understand, and so many people don't understand because there's so many layers and so many facts and information that they're not tied together, and it's just so complex. And I just really want to applaud you guys for bringing up the conversation, having the conversation, continuing to figure out how to merge the cannabis plant back together. At the farm level, the plant's the same and just needs to be grown like agriculture, but there needs to be protections for farmers who are growing sinsemilla versus hemp farmers who don't care about seeds and cross pollination. And then at the end, being able to make sure that there is safety measures and standards in place for consumers, whether it's just the flower or whether it's manufactured products. And I really appreciate the space to be having this conversation and continue to say thank you.
Thank you. Call-in user number 4, I've just sent you a request to unmute. Ooh, we lost you, call-in user number 4. If you'd like to make a comment, raise your hand once again. In the meantime, Judy Strang, just sent you a request to unmute.
Hello there. I was thinking about a recent experience we had with code enforcement at one of our cities here in Southern California. And this particular city, being small, had the capacity and the interest in trying to remove those products, in this case from tobacco retailers, that were illegal hemp products. And so they asked for a comprehensive list of what products they should be looking for that wouldn't be legal beyond our just definition of something that would be synthetic. And we couldn't find anything to give him. So I echo what have been previous comments regarding we really need from the department to, if a picture, even if you could have a couple of pages of pictures. I realize the products change as fast as you can probably put together something, but there are some that are continuous across our stores, and that at least be a good place to start. Thank you.
Thank you. All right, call-in user number 4. Just sent you a request to unmute. *3. There you go.
Am I there? Okay, Nicole Robles, representing the Green Nurses and Bloom Hemp.
All right, call-in user number 4. Can you talk? We can't hear you. Call-in user number 4. Your mic is open.
Can you hear me?
Yes, now we can.
Okay, perfect. Hi, Nicole Robles, representing the Green Nurses and Bloom Hemp, who manufacture good hemp medicine out of Colorado. We are struggling getting into licensed dispensaries in California and getting away from the stigma of the gas station weed and smoke shops. We need access from the DCC to distribute and license dispensaries and looking for guidance on how to do this. Thank you.
Thank you. All right. This is a last call for agenda item number 5. Oh, one more. Dave Jorgensen, I've just sent you a request to unmute. Dave Jorgensen. Dave Jorgensen, I've sent you a request to unmute. I'm sorry, we're about to close comment on this. I'll send you another invitation, see if that works. I regret there seems to be something with your side because it will not let you unmute. Let's try this again.
I think he unraised his hand. With that, seeing that there's no more public comment, thank you for your attendance, Mr. Yi. That was very educational. And we're going to close item number 5, moving on to item number 6.
Thank you.
All right, overview of the DCC data dashboards. Moving on to item number 6, a presentation on the new DCC data dashboards. We welcome Sean O'Connor, the Chief Information Officer of DCC, to present this topic. Sean, the floor is yours.
Thank you, Chair Jamalian and members of the committee. As mentioned, my name is Sean O'Connor. My role is referred to as the Chief Information Officer or the Deputy Director of the Information Technology Services Division. The first one's a little easier to say than the second one, so I'll usually go with the first one. But one of my favorite parts of my job is working with my staff and collaborating with others within the department to improve our abilities to access and analyze the robust amounts of licensing and track and trace data that we have here in the department. And that's what my presentation today regarding the data dashboards is going to focus on. I'd like to first give a bit of background, and then we'll do a walkthrough of the dashboards as they exist on our site right today. So our data dashboards launched on our public-facing website in February of 2024, and the product is a result of a collaboration between my division, the Information Technology Services Division, and our Policy and Research Division. And I just wanted to point out that while I'm presenting it, I have the pleasure of doing that. I can assure you that all the cool and good stuff that you're going to see on these dashboards is a result of those staff that were so invested in trying to make this as good as we possibly could for our first iteration at these data dashboards. So I thank those staff and appreciate the collaboration of those individuals. As I mentioned, the dashboards are accessible from our website. You don't need a special login. You don't need any special software. You can access them directly over the web. They utilize a software application and technology called Tableau. That is a common technology that many organizations use to display kind of data and interactive graphical sorts of data elements to internal and external folks. The data displayed in these dashboards is aggregated data from our licensing and track and trace software databases. So this is rolled up data. So this is not line by line transactional data. So we've grouped it and rolled it up by some useful data variables. This is also not a real-time connection to our databases by design, as we do have a rather extensive validation and verification process that we go through before we post updates to our data dashboards. That is a very involved process that can take time, particularly for our track and trace data, which is licensee entered data, and we comb through that to make sure that we have as high a degree of confidence as we possibly can in the data that we are displaying online. I also want to point out, and you'll see through the walkthrough that I'll provide, that we post an extensive explanatory notes and changelog section, as we really value the transparency and want individuals who want to do a deep dive into the data and want to know what every little term we use means and how we've grouped things. we wanted to provide them a resource to do that if they wanted to. For more casual users, they don't need to really review the explanatory notes. I think most of the things are self-evident as you go through it. But for those who are really interested in the industry about how we've grouped things, those explanatory notes are there. So without further ado, I'm going to share my screen and I'll walk through some highlights of our data dashboard. So I'm going to go ahead and do that now. I think I need to be made a presenter to share my screen.
Working on that, Sean. Hold on a second.
No problem.
Yeah, hold on, Sean. It's just taking a second.
Sure, no problem.
Actually, you try it. It's the presenter. It's on David Cito right now. It doesn't scroll when you drag that.
Yeah, it doesn't look like I'm the presenter right now. I think if you you might be able to right click or something like that on David, Nina, and then take the presenter role away from him. And then I think you might be able to assign it to me. All right, I just got a message that I am now the presenter. Thank you everyone for the patience as we do a little bit of shuffling and roles on WebEx. So now I am sharing my screen and folks should be able to see that now. Just want to confirm, Nina, can you guys see the screen that I'm sharing? I see some nodding from our members of the committee, so I'm going to take that as a good sign. So I will go ahead and walk through a couple of items here. So I'm on our general website here. I just wanted to show how you can navigate to the data dashboards. There's a couple ways to get to them, but the easiest is to just select resources here from the top. And right at the top, we put our data dashboards. So you can select that. From here, you're taken to our initial landing page, and we have 4 groupings of dashboards here currently that we are making available. I'll talk a bit more about how we're going to iterate on this feature and what our future plans are for it towards the end of this presentation. But right now we have 4 groupings of dashboards that are accessible. As you select one of these, you'll be able to pull up those dashboards. So I'm going to walk through a few features of each of them quickly, but really encourage anyone who is interested to take the time to go to the website and explore it on their own. I certainly won't be able to go through all of the features that are available and all the different angles and cuts at the data you can look at. So I'm going to select first our cannabis license summary report. So as you can see here, I'm taken to a interactive data dashboard with a variety of different data elements within it. This data is tied to our licensing data. So this is not track and trace data. We'll get into that in the next 3 that I'll show you. But this is a breakdown of active licensees that we have. You can see there's a couple different types of breakdowns that we're providing by different license category types, by provisional or annual. Also up here at the top, you have a variety of different filters that you can change. So we automatically set it to active, but if you also wanted to bring in canceled, expired, limited operations, whatever you like, you can select those and you can see that the numbers changed automatically there. So you can kind of play with this data, look at it from different perspectives that might be of your interest as you see fit. And then within this one as well, we have a provisional and annual report. So this is a look at the same source data, but just looking at it more exclusively from an angle of annual versus provisional license breakdowns. So you can see here we have days till expiration broken down here with counts. We really tried to think about useful ways that folks might want to look at this data to be able to glean information about trends or things of that nature. So this is our cannabis license summary report. I'm going to take a few steps back and go into next our harvest report. So this is the first of the reports that utilizes our track and trace data. So for all the data that you're about to see associated with our track and trace data, it's pulling in information from January of 2020 through December of 2023. So all those calendar years worth of data is available within this within these data dashboards. This particular harvest report here, you can set it to a particular year. Let's just focus on 2023 for these purposes. You can even drill down into specific quarters or months. And you can see here that in this particular summary report, we have it broken down by the type of cultivator that we have here. So indoor versus outdoor, nursery, mixed light, and micro business, along with variety of different categories here for plant count, moisture loss, package count, etc. And some trend lines down here at the bottom. These are kind of breakdowns and trend lines throughout the year for each of these subcategories, as you can see broken down by quarter. I'm not going to go through all these tabs, but again, I really, if you're interested in this, suggest you spend some time going through this. There's some interesting data here. I'm going to focus on one of the items here that we think is a particularly interesting way to look at this data, and that is our county level harvest report. So this looks at those same types of data elements, but more from the a county by county sort of side by side comparison. So I'm going to zero in here again on 2023. Again, I just want to put a plug in that I'm not using any sort of special software. I'm just accessing this over the internet. Everybody can go and look at this right after the meeting if they wanted to. And I can see here that I have all of the counties here. And then I can also select specific counties. So if I just wanted to compare, let's say, Los Angeles, let's say Humboldt, and Sacramento. It's a really easy way, if you have specific counties of interest, to kind of look at different trends across specific counties and what those data elements might be. All right, moving right along, I want to go to our sales and price per unit report. So these next two items are focused on the retail sales side of the supply chain. So the harvest we're setting aside and kind of focusing exclusively on sales here. So here you can see, looking at sales broken down by dollars, the trends since 2020 through 2023 for purely looking at dollars for these different high-level categories. We have broken down about 36 different types of item categories in our track and trace data into this, about dozen of groupings of data. So there's multiple different categories that roll up into flower, for example, vape, extract, and concentrate. And in our glossary, we get into specifics about what categories are rolling up in that. Again, trying to value transparency to show you how we are grouping the data and moving for it to be displayed. One tab on this that we've gotten quite a bit of feedback on is our price per unit report. So within this, we provide a simple math breakdown of the amount of units sold for a particular item category, as we see here, packaged 8, the total amount of sales that we have divided by the units to get a price per unit for each of these categories. We can also adjust this for the years. This is doing a complete aggregated amount, but you can select 2023 and it will tell you the calculation for it just based on that particular year. You can also go to 2022. So if you wanted to compare specific item categories and their trends in prices over year, you can adjust the values there in the years to see that. All right. Just a couple more items here, and then I'll open it up to questions from the committee. So this last one is also looking at sales just from a different, really high level type of view here. So this is breaking down the total sales again by dollars throughout the time period that we have data for, 2020 through 2023. We see a table over here at the right that shows it broken down. And then we can also, one other way that these are interactive, and I'm going to show you real quick. I'm just going to focus on 2023 data again. So as we do that, our data is filtered down to that. I believe if we select just one of these, yeah, so you'll notice that the sales figures per month that are broken down in the upper left here can change if you want to just filter only by vape or these different categories. You can see for those specific categories what the trends were broken down by month for 2023. So there's a lot of different ways that you can play with this data, interact with this data to get what you're looking for. And I encourage folks, if you're interested, to do that. Finally, the last thing I'm going to close with is that data dashboard glossary. So I've heard comments from some folks. They said, wow, you've got a really long glossary, and we will admittedly admit that it is pretty verbose. But we put a premium on trying to provide as much information as we thought would be helpful for those that did want to go through the glossary and really understand what is going on with our data. So you'll see a very long and set of information here talking about the different labels and what they mean, talking about some particulars about the data where needed, just to provide as much context as possible. We're trying to answer as many questions as someone who's really doing a deep dive might have. Provide them with that information so that they don't have to reach out and ask questions of us, which we're happy to take, but would rather provide more of a self-service kind of model for that. And then finally, down here at the bottom, we have a data dashboard change log. So when we make updates to the dashboard, we include the date that we made the updates, the nature of that update, so that folks are aware and who are looking at this over time and might see something change, they'll understand why there was a change. As you can see, since we launched it in February, we've only made one major update to the dashboard, and both of those changes that occurred on May 7th are outlined here. Most of those, and those changes were predominantly related to updating the data through the end of 2023, which wasn't available at initial launch, and then just drawing attention to a small amount of records we identified that were likely outliers that we removed from the database. I should mention too, in our validation process, if we find a record that we believe is an outlier, we don't modify the record, we just remove it from the set because we're not sure what the licensee who entered it intended it to be. We can usually make an educated guess, but we've made the determination that removing that record is the best practice, and it's relatively few records that we have to do that for. So that concludes my presentation. Thank you for the time, and I will hold now for any questions from the committee.
Thank you, Sean. Committee members, floor is open for discussion.
On the sales report, the monthly sales report, I saw a tab or a menu for consumer type. Can you say a little bit more about that?
Yeah, sure. I think that this is the one to which you were referring. We do have a sales by customer type. Within the track and trace database, there is a spot when tracking retail sales where you can indicate whether the sale or transaction was to a general consumer, to a patient, or to a caregiver. So this just breaks that down based on what that data looks like in the system. That's the nature of this particular data element.
I have a question regarding the licensing dashboard. Does it also track applications, active applications, or is it just issued and provisional?
These are issued applications, so it is pulling from a data source right now that is tied to the same database that feeds our consumer license search. So this data is tied to that. It refreshes weekly, so it does not show pending application data, application approval data, or things of that nature at this time. I will say that we're constantly evaluating and iterating upon this and trying to come up with additional data displays that might be helpful. We've gotten some really great feedback from researchers and folks and external stakeholders who are interested. So we're taking those ideas back, and this is going to be a a feature that will be iterated upon, both through, displaying potentially different types of data or different ways to display the data, as well as updating technology to try and make it refresh a little bit more quickly is something we're looking into this year.
But is tracking applications and their time and conversion part of the roadmap, or it might be part of the roadmap the way that I just understood it?
I think that we are constantly looking at it. We don't have that identified as a definitive roadmap item with a date that we will update it. So I think answering your question from that perspective, I would say no. But I would also say generally that we haven't gone through and said, like, we haven't really I would say given that aspect of the data much focus on how we would display that. So no active plans at this time, but like all of the data that we collect, we would evaluate it and see if there's value in displaying that publicly for folks in some form or fashion.
Appreciate it. Thank you. Any other questions from committee members? If we don't have any, then I would like to open up for public comment.
I guess just one small question.
Yeah, please, Michael, go ahead.
On the cannabis license summary report too, is there any way of determining like multiple license holders, or to any kind of filter for that? Someone that might own a cultivation, distribution, or like.
Yeah, that's a great question. Not in the display of the data that we have right now, but I will take that back. That is an item of interest that we can take a look at here. I'm not, like I mentioned, we're looking at this and iterating upon this. We know that the versions that you guys are seeing now is kind of 1.0. We are investing time with staff and technology and things of that nature to continue to make this better and better. So I'll take that back as an item that is another way that we could potentially look at this data. So thank you. Yeah. So not available right now, but appreciate the feedback. That's helpful.
Yeah, thanks.
Thank you, Michael. And it's a pretty good 1.0 version. It definitely displays a lot of useful data. Any other comments? Can we open for public comment, please, moderator?
Absolutely. All right, we are now taking public comment on agenda item number 6, which is DCC's new data dashboards. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged on to the meeting, or by pressing *3 if you've called in the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak. And with that, we'll get to our first commenter, which is Jason Shirosh. Just sent you a request to unmute.
Members of the committee, my name is Jason Sarouche. I'm a policy research associate at the Public Health Institute. Thank you again for this opportunity to speak. So I wanted to thank the DCC for putting out this data dashboard. As a researcher, this has been very helpful. I also, since you brought up the glossary, some of the detail is much appreciated. However, some of the terms like edible, like what goes into the edible category and its edible volume, each edible volume, these are just kind of how it's in metric, I'm guessing. It would be really helpful for research to know what, because you're giving a price based on or number of units, but what is the volume of each of these? And edible doesn't matter quite as much, but for flower, for other products like pre-rolls, for vapes, for concentrates, knowing what the weight is instead of just saying shake weight, like what is the average weight of a unit of shake in that group that you're lumping it into. That would be really helpful. And obviously it is happening where you do have weights for some product categories, but it's really hard to see the full picture if, you just have a kind of generic term that says weight, but then no description of what the average weight of the products in that category are. So that's just one piece of feedback I have. But generally, thank you so much for putting this out. This is a really, really helpful tool, and I look forward to seeing it improve over time.
Thank you. All right. Is there any other public comment on agenda item number 6? Last call. All right, Chair
All
Jamal,
right.
I think we can comment. Thank you.
Thank you. That concludes agenda item number 6. Moving on to agenda item number 7, a presentation on the DCC Consumer Awareness Program. David Zito of the DCC will give us an overview of the program. David, the floor is yours, and thanks for being here.
Hello, and thank you for the introduction, Chair Jamalian. I am David Zito, campaign manager for the Department of Cannabis Control. I helped develop and market the Consumer Awareness Campaign, which was designed to inform consumers on the existence of unlicensed retailers and how to tell them apart from license. The campaign launched in February 2024, starting with billboards and then transitioned over to social media ads. The Consumer Awareness Campaign established a brand, Real California Cannabis, as you can see here, to set unlicensed cannabis apart from licensed and symbolize all the beneficial aspects of California's legal market. One leading view the primary audience considered important about the legal market is that licensed businesses often care about issues important to consumers, like worker protection, community development, and public safety. Only licensed cannabis that was cultivated and processed under DCC regulations meet standards for safe consumption and can be considered real California cannabis. Next slide, please. Real California Cannabis connects with its audience by using language that resonates broadly, along with a fresh, relatable aesthetic and inclusive visuals that appeals to a diverse demographic. So this is just broad reaching for California. This helped elevate legal retailers as the only supplier of real California cannabis while educating consumers about what is real and what is illegal. Next slide, please. Since the campaign's statewide soft launch in early February 2024, it has achieved the following statistics through digital advertising alone. 117,948,080 impressions, 655,119 engagements, including clicks, 84,073 clicks, 81,287 unique website visits, and 15,000 Google searches. Excuse me, getting over a cold over here. As we continue monitoring consumer reaction and reception to Real California Cannabis, we will adjust the campaign's messaging to build a stronger connection with its audience. So we are constantly evaluating consumer reactions to our ads and just seeing what the reception is like, and we want to adjust the messaging just to make sure we are really connecting and speaking to the audience. Next slide, please. And so we do have latest video. I was told that the audio is not working, but if you do go to our consumer facing website for Real, it's real.cannabis.ca.gov, which is just our main cannabis webpage with the word real in front of it. So real.cannabis.ca.gov. And we'll be displaying video 3 there shortly. We'll be putting it up. But right now there is a public service announcement video that introduces the campaign and talks about the importance of educating consumers. And the whole website itself has a lot of information and resources on why it's important to educate consumers, as well as a new search feature that we had designed as part of the campaign to make it easier for consumers to look up licensed retailers and find near them. So there's location-based services that will guide consumers to licensed cannabis dispensaries that are in DCC's network. And that concludes my presentation.
Thank you, David.
Thank you.
Any input, feedback from my fellow committee members? I think we'll open up for public comment. Moderator, if you don't mind.
You bet. All right, we are open for public comment on agenda item number 7, which is DCC's Consumer Awareness Campaign. So if you would like to make a comment, you can raise your hand by clicking the hand icon next to your name or by pressing *3 if you've called into the meeting. Each commenter will have 2 minutes with a 30-second warning and 1 opportunity to speak on each agenda item. And with that, we will go to John Byram. I've just sent you a request to unmute. Go ahead, John.
I was wondering if you're in your
campaign, do you mention that Delta 9 THC can interact with medications that doctors give out and CBD? I mean, the THC level on Delta 9, over 500 interactions with medications. With CBD, it's over 700. Are you mentioning in any of this how it interacts with medications? Thank you.
Thank you. All right, is there any other comment on agenda item number 7? All right, Chair Jamali, I think, whoop, one more. I'm sorry, spoke too soon.
That's
Judy,
okay.
Judy just sent you a request to unmute.
Perhaps it was me, but what I was hearing is that you did distribute the consumer awareness campaign materials through social media. Did you name the social media that it was distributed through? And how did you choose those particular social media platforms?
Thank you for your comment.
I'm going to remind commenters that this is not a question and answer period. This is public comment on the campaign. And with that, Samantha de Trinidad, I've sent you a request to unmute.
Can you hear me?
Yes.
Thank you. I understand this is not a question forum, so I'll try to phrase this as best I can. The Real Cannabis campaign seems similar to the Emblem program that's currently being rolled out in Los Angeles for primarily retailers at this time, as I understand, but all licensees eventually. So I'm curious if this is a program that retailers, for example, will need to apply for and display the emblem. And I suppose, hopefully, I can get that information on the website.
Thank you for your comment.
Thank you. Peggy Walker, I've just sent you a request to unmute. Go ahead, Peggy.
Congratulations. A great start. I'm just wondering if this might not be a great place, and I'd like to suggest it would be a great place to have an alert or call to attention to consumers to be careful with, as several people mentioned earlier, to be careful in keeping products out of the reach of children. I mean, this just seems like the ideal place to put out that warning that we want to keep it out of the hands of kids and to reduce those levels of ER admissions and child poisonings. Please, please take heed in where you keep and store your products. Just a suggestion. Thank you.
Thank you very much. All right, and Phil Engfer, I've just sent you a request to unmute.
Thanks for the time. I appreciate the consumer outreach. I think this is an important topic. I'd also like to suggest maybe the addition as well of some energy and messaging around the OCal program and the availability of organic products that are now approved by CDFA as well as and available to consumers that have not been grown with synthetic fertilizers or pesticides. I think it shares in the awareness as well as the consumer concern, and would be a good place for that information campaign as well.
Thank you. All right, last call for public comment on agenda item number 7. All right.
All right, seeing no more public comment, we're going to conclude agenda item number 7, moving on to agenda item number 8. David, thank you for being here. Agenda item number 8 is an update on labor peace agreements. Deputy Director Jacqueline Campion will now give us an update on the upcoming requirements for licensees and forthcoming rulemaking on labor peace agreement. Jacqueline, the floor is yours once again.
Thank you so much, Chair Jamelian. Can everyone hear me all right? All right, I will proceed. Thank you. Currently, statute requires cannabis businesses with 20 or more employees to enter into and abide by a labor peace agreement with a bona fide labor organization. As of July 1st of this year, the Business and Professions Code is going to be updated, and this requirement will kick in for cannabis businesses with 10 or more employees. At the September meeting of the Cannabis Advisory Committee meeting, we heard from the Agricultural Labor Relations Board, as well as other voices from the labor community, information about labor peace agreements, as well as recommendations for ways to strengthen and enhance LPA policy to make it more meaningful for the California cannabis market and for the employees who support it. One of these recommendations that we heard last fall was to make labor peace agreement signatories with licensees available via a publicly accessible and searchable database. DCC published a website update in August, which does include this. Since then, the department has continued the conversation with labor entities and has been working on developing policy concepts for inclusion in a forthcoming rulemaking package. I would like to share with you an overview of these proposed concepts and invite any feedback to help inform the department's efforts. This summer, the department intends to propose that cannabis businesses who are subject to labor peace agreement requirements, those with 10 or more employees, given the July 1st statutory update, who had previously submitted a notarized statement to DCC to enter into a labor peace agreement and to submit that full LPA to DCC. The department also proposes requiring cannabis businesses to disclose how many employees they have at the time they submit their license application, provide a standard for how employees should be counted, and specify how to verify the employee count for purposes of LPA compliance, require cannabis businesses to post the labor peace agreement in an area of the premises that is accessible to employees to ensure that employees are aware of the information, specify that a labor peace agreement must continue to be active throughout the duration of the license, and finally, this is an existing requirement, but in the interest of continuously improving our regulations to ensure they are clear and easy to understand, specify that labor peace agreements are subject to disclosure under the Public Records Act. And that concludes my update. Again, I invite any feedback on these proposed regulations. Thank you so much. Back to you, Chair Jamelian.
Thank you, Jacqueline. Floor is open for discussion.
Hello, I recognize through the chair. Sorry. It's okay if I speak.
Absolutely, it's an open floor.
Okay. I just want to say that we're very supportive of this work around transparency for the LPA. We agree that having the data around how many employees for each licensee is important. So if a parent company has like 100 workers and it's split between 10 entities, we would like clarification around they are still required to sign an LPA. I also just want to acknowledge from the last meeting, and I know many of you know this, but an LPA is not a one size fits all. Like it is an agreement between the employer and the union. And so I just want to, it needs to be able to provide protection to the workforce, and they need to be able to be enforceable. I think to do that, and then any enforcement around this LPA provision really protects the industry against sham unions and ensure that all LPA should ensure, and the negotiated contract should ensure that workers have a voice. And again, this creates a more robust, I think, and safe industry for both workers and for the public. So thank you for the presentation and also for putting this on the agenda. I think it's incredibly important that we all understand what the new regulation that's coming in that reduces the threshold for the LPA. And yeah, just really appreciate the discussion around this. So thank you.
Thank you, Member Parrish. Any other comments, feedback, questions? With that, could we open for public comment, please?
Absolutely. We are now taking public comment on agenda item number 8, which is labor peace agreements. If you'd like to make a comment, please raise your hand by clicking the hand icon next to your name or by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak on each agenda item. And with that, let's see if we have any commenters. Lorena Ritchie, I've sent you a request to unmute.
City of Palm Desert, thank you so much for this forum. It is very educational, and so thank you, all of you, for your time. I know we can't ask questions, but for local or government jurisdictions, will there be anything from DCC how we will play a part in all of this going into effect next month? If that could be addressed. Thank you.
Thank you. All right, I'm not seeing any other comments for this agenda item.
Thank you. Seeing no more public comment, that concludes agenda item number 8. Moving on to agenda item number 9, recommendations for future agenda items. I will work with the DCC to set the meeting dates and agenda items, but this is a good opportunity for members to give some influence on the agenda and what you want to see discussed. As I had hinted towards in my opening statement, I'm very interested in getting a report from the Cultivation Licensing Department to create a little bit more transparency for applicants, to get a feel for expectation management. How long should they expect to take for an application? Obviously, we have some data that was published in the previous legislative report, but I don't think that data reflects the current situation. So it'd be nice. That's something that I would like to see on the agenda. With that, the floor is open for discussion.
Chair, Antonio here.
Yes, please.
Yes, again, I know we just heard from the education campaign, but would love for the CAC to formally discuss what type of education campaigns that we think would best benefit the industry and get more collaboration there. You know, there was even questions about how the campaign was supposed to roll out, what the requirements were. It was done in February, and not everyone seems to be aware. So just trying to find a better way to engage the actual operators and the people in the industry with these campaigns so that those dollars can be used to better influence the market.
Yeah, I believe there was, and I'll defer to the DCC. I was on one call where the agency had invited some members from the industry and from the community to give input, but I think that can be broadened. It was a very select group that was contacted, so maybe David and his team could make a public call for people that are interested or do some polling within the industry. I think it's a great idea. I'm sure we can formulate a brief point on the next agenda around that. I'd also like to see how effective our recommendations are. I'm not quite sure yet how to word an agenda item around that, but tracking recommendations and what happens to those recommendations coming out of the CAC would be interesting to me. I don't know how the rest of the committee feels about that.
Now, this has come up at previous meetings, but one thing I'd still like to hear about is the United Cannabis Enforcement Task Force, I believe is the acronym, UCETF. and any information the DCC can give from their perspective. If the Fish and Wildlife was interested in also joining, that would also be helpful, as I know it's a joint program. And this, I don't know to what degree we can get a report from the Department of Justice, but I am interested also in the EPIC program and also the program, I'm not sure the acronym, that was launched last year too, around facilitating kind of like financial consequences for illicit operators. So any and all of that would be wonderful.
Thank you, Michael.
I was going to offer a couple of potential topics. So you had mentioned about, I'm interested also in timelines from submission of application to issuance for operators. And then I'm also kind of interested in seeing about opportunities to, I'm not sure, improve or, better the communication between DCC and counties and, get a gauge or a pulse on, how that's working and where there could be areas for more conversation or on updates or something along these lines. And I'm also still somewhat interested in like metric viewer analysis for counties and the data that's available or not available, and if there's any way to make it more robust. And lastly, one of the public commenters mentioned this, and this may be premature, but also, conversations or, about rescheduling and impacts that could be further down the road. And so that might be an early conversation, but just want to consider some of those topics. And so those are my suggestions. Thank you.
Thank you, Carmela. I think a couple of those topics can be worked into some agenda items that we're planning on, like permitting and streamlining communication with local governments sort of goes into the same bucket, I believe, because it's mostly part of the permitting process. I think some of the points Michael made can be worked in there. And as for reports, I agree. I'll talk to the DCC to see what's realistically attainable in the time frame in terms of reports, and someone might reach out to you for some clarification. If there's no other input, I would like to open for public comment, please.
All right. We are now taking public comment on agenda item number 9. Recommendations for future agenda items. If you'd like to make a comment on this agenda item, please indicate that by raising your hand, by clicking on the icon next to your name if you've logged into the meeting, or by pressing *3 if you've called in. All commenters have 2 minutes to speak with a 30-second warning and 1 opportunity to speak on this agenda item. And with that, let's see if we have anybody who wants to offer some recommendations for future agenda items. Judy Strang just sent you a request to unmute.
Hello. Regarding opportunities in the future, the meeting we had in the past that was a combined meeting with the Public Health Department and the work they're doing there would be extraordinary if we could repeat that. It was really useful. And within the California Department of Public Health, they have a tobacco control program, and they've been putting out material about marijuana as part of their consumer awareness and public health education. It would, again, be useful to us here on the ground, if you would, trying to do parent education, to hear from both of the folks involved with California Department of Public Health in general and the tobacco control program.
Thank you. Craig with Alpenglow Farms, I've just sent you a request to unmute.
Thank you for taking my comment. For future meetings, I've requested this before, and I know we have a micro business, but a micro business isn't so micro. We're a farm that's 10,000 square feet and under, and we really would benefit from having a transportation license and a nursery license built into the cultivation license that we already purchase, right? Like that would really benefit us. I know there's cottage license and micro business, but we still fall in between. I think the micro business was originally intended for a farm like ours, but through time, it really, the format came for much larger businesses. So if we could get something on the agenda for maybe what I would consider the homestead license or 10,000 square feet to include cultivation and nursery license. I appreciate that. And another conversation I would like to open up is what is driving the illicit or traditional market? And that is the biggest spread between pricing of a regulated taxed product and the product you can get on the street. And it comes around to hemp and it comes around to cannabis. And until we close these gaps and lower taxation and make a product more readily available to more people through affordability, we're forever going to be driving a illicit or traditional market. So thank you for the time. And those are my 2 points. Thank you.
Thank you. All right. Last call for recommendations for future agenda items. That's agenda item number 9. Is there any other comments? Kenneth, I've just sent you a request to unmute.
But I think it has in the past. But I would like to suggest an agenda item in the future to talk about the youth appealing products and what the DCC is doing to remove these products from the marketplace, since they're so, they're flavored, they're attractive to young people, and they're not supposed to be in the marketplace, but they are. And so we need to have a discussion about it. They're very potent, they're addictive, they're harming our children, and we need to remove them from the market, and we need to take it seriously. The second is that we do not have, we've had a marketplace for about 5 years now, but have we ever done one minor decoy operation on a delivery service? We went through a whole lot of time in putting together all the rules and recommendations for delivery drivers, but we're not checking to see that they're adhering to the laundry list of regulations that they should be following. And most importantly, we're not understanding if these delivery drivers are IDing at the time that they're dropping off their product on the doorstep. That's really important to reduce youth access. So 2 important discussion items. Thank you so much for your time. I appreciate it.
Thank you. All right, call-in user number 4. I've just sent you a request to unmute.
We would like to see how to get good hemp products in California.
Call-in user number 4, we can't hear you.
Can you hear me now?
Yes.
Okay, we would like to see how to get good hemp products into the California licensed dispensaries. I think it's important to have good medicine out there, and we can't get it into local licensed dispensaries at this time. Thank you.
Thank you. All right, last call for agenda item number 9. Looks like we are finished with public comment on this agenda item.
Thank you, moderator. That concludes agenda item number 9. Meeting is adjourned. Thank you, members, for your time.